Hello friends, welcome to my channel Doctor Online 24/7. Today, I am here to talk about cholera disease. It's not a new disease, it is an ancient disease, which has caused a lot of outbreaks, especially whenever the sanitation is a problem. It has caused outbreaks usually when there is a mass gatherings or usually after an earthquake where there is a problem of shelter and sanitation. What is this cholera? How does it happen? How does it spreads? What is cholera? Cholera is basically a bacterial disease. It is called vibrio cholerae, and then bacteria, which usually spreads through contaminated water, contaminated food. It's basically a bacterial infection, so how does somebody acquires this infection? This bacterial infection is acquired once you have taken a contaminated food or water. Once it enters the body, after how many hours the patient will develop symptoms. It can ranges vary from 5 hours to 5 days. Patients can develop usually symptoms on second day or the day 3, where patients will present with various forms of symptoms. Symptoms of cholera. Common symptoms are like vomiting. They'll have abdominal distension and they can develop loose motions, so this loose stools or the loose motions can be mild, so in such cases it can be managed at home. Sometimes it can be very severe where the patient will have an explosive diarrhea, where patients can have 20 to 30 times loose stools in a day. You can imagine with so much of loose stools what can happen to the body. Some people can lose even up to 20 liters per day in stools. Because of there is so much of loss of fluid, patients will develop signs of dehydration, they can develop sunken eyes, they can lose their skin terror, there will be extreme thirst to the patients. Because there is so much of fluid loss, they can develop low BP and can lead even into shock. With so much of fluid loss, some of these patients can land up in kidney injury. Also, we call it as acute kidney injury. In very severe cases, sometimes they require even hemodialysis also. And with the loss of fluid, patients also loses various electrolytes. The common ones is a potassium, which can lead to hypokalemia, and the basal patients can present with various muscle cramps. Diagnosis of cholera. Diagnosis: usually we take a good history. There is an explosive diarrhea. We classically call this a rice water diarrhea, where the stools will not have any pigments. So that is a classical, and you may have a contact with the patients of diarrhea, or there can be an outbreak in that city. All this which will be taken into consideration, and finally we do a stool examination. The stool will be tested under the microscopy, where you can see a motile bacteria in the microscope. It is called hanging drop preparation. Once you have diagnosed the disease, how do we manage them? As I already told you, the cholera can be mild. In such cases it can be managed at home. The most important thing is rehydration, so adequately you will have to give them fluids. The most commonly used is oral rehydration, solution, that is ORS. Other things: there are certain foods you need to take, like you can take buttermilk, you can take tender coconut, you can take soups, and you can take rice-based items. Rice-based items are excellent because they increases absorption of sugar as well as your electrolytes, so you can take rice-based items. What to avoid? Your diarrhea or loose motions especially, you need to cut down on fruits and fruit juices, because fruits have a lot of fructose. We don't digest them during these episodes of diarrhea, may increase your loose motions. Please avoid milk products. Out of milk products you can take only is the buttermilk. You need to avoid milk. You need to avoid coffee, tea, these things should be avoided. Avoid sweets, and you can also avoid this carbonated water like colas. These are the things should be avoided. If symptoms are severe, if there is frequent episodes of vomiting, not able to tolerate orally, please visit a nearby hospital, because if you leave them, severe cholera can even lead to fatality or the death in about 40% of the patients, so please go to a hospital. Once you reach a hospital, most important thing is giving you fluids, so usually given IV fluids, and adequate rehydration will be done, so patient may be given potassium supplements to correct the electrolyte imbalance. And you need to give an antibiotics. Usually a single dose of doxycycline. Prevention of cholera. The most important thing is sanitization and as well as hand hygiene, which is very important. Another thing you need to take care is what you drink and what you eat. It's spread through the contaminated water, so make sure that you drink only bottled water, or a boiled water, or one which is treated, that is chlorinated water. Second thing, with respect to food, please avoid eating roadsides, you may catch an infection. Make sure that what you eat is hygienic. Anything which is served hot is still okay, because it will be boiled and cooked. If it is something cold, especially like fruit, juices, those thick should be avoided because you may catch an infection. Other thing you need to take care is hand hygiene, because hand hygiene is very important. Please wash your hands properly after use your washroom. Please wash your hands properly before eating, and if you are an adult treating a kid or feeding a kid, make sure that you wash your hands properly before feeding the child, so even in children also cholera can affect. Homeopathic treatment for cholera. Homeopathic medicines for cholera can be very effective in controlling and even preventing it. Veratrum album, arsenic album, camphor, croton tiglium, podophyllum, aloe, cuprum met, ipecac, colchicum. This is all about cholera. Hope you like it. Thanks for watching Doctor Online 24/7 by Dr. Sana Bawani. Don't forget to like, share and subscribe my channel.